Good afternoon, everybody. You're very welcome to join us. My name is Juanita Guidra, and I work in the National Quality and Patient Safety Directorate. And I'm joined today by Tibbs Pereira. Tibbs, I'll let you introduce yourself there.
Hello, thanks, Juanita, and welcome, everybody. My name is Tibbs Pereira. I'm a member of Patients for Patient Safety Ireland. We're a voluntary group set up under a World Health Organization programme.
So for those of you that haven't heard about World Patient Safety Day, although I'm sure many of you have at this stage, it's an annual day that's celebrated, set up by the World Health Organization, and it's celebrated across the world, predominantly in healthcare organizations. And the theme this year is engaging patients for patient safety. So the whole thought around that is that crucial role that patients, families and caregivers play in the safety of healthcare. So this particular talk time pays homage to that. And what we're going to do is we have some fantastic speakers, and we'll just pop them up. We have Kate O'Flaherty from the NPSO, Helen Ryan with Solace, Norma Deasy, Paula Cusson-Murphy, Beth Farron, Clara Meehan, Cathal Klein and Martina Porter. And we'll introduce them all as we move through our session.
In a little bit more detail, what are the objectives of this session? So firstly, we've been doing a lot of work, together with, the HSE has been doing a lot of work, and we've been very fortunate to be included in co-production of a number of resources. We're launching Your Health, Your Voice resources prepared to mark World Patient Safety Day. It's really important that we'll be hearing from a number of people who've done some amazing work and who are doing some amazing work, and to share those tips to improve health literacy in communication with service users. We'll also hear from Kate O'Flaherty about an OECD report focused on patient partnership. And finally, just to get ideas from a number of services across Ireland to mark World Patient Safety Day. So please do engage with the chat box. I'll hand over back to Juanita to introduce Kate O'Flaherty.
That's brilliant. Thank you so much, Tibbs. It's my absolute pleasure to welcome Kate O'Flaherty, who's the Director of the National Patient Safety Office in the Department of Health. And Kate, you've been in post now for almost 5 months. We might start off, if you could tell us a little bit about what your key priorities are, and why do you think it is important for the next chapter in patient safety?
Thanks, Juanita. Yeah, I'm delighted to be here. As you say, I'm not long in post, so it's my first QPS TalkTime and my first World Patient Safety Day in this role. I think it's a very exciting time. We are, I think, on the verge of a new chapter in patient safety in Ireland. And there's probably two main elements to that. One, you've mentioned, Tibbs mentioned the OECD. So looking at the WHO, the World Health Organization has a global plan. The OECD have a whole series of research pieces around I suppose the economics of patient safety. So making the case, helping us make the case for investment in not only saving money, but saving lives. So the latest report on that then is on patient engagement, which will be published this week. So really looking forward to kind of reading into the detail of that. Ireland has contributed a lot of data and information through the global survey into it. So I think it's really important for us as we're going on to the next chapter of us being able to benchmark ourselves internationally, because sometimes we focus on rightly on the problems or the challenges, but often it's good to sort of see where we stand and benchmark against international comparisons and the evidence. And I think the other main priority really looking forward to next year is with the launch of care reforms and the health regions coming in, how do we continue to work with the great QPS team and dare I say family and all of the patients and advocates part of that to just make sure that we build a continually improving system for assurance for patient safety and patient engagement as we move to the new regions and the new structures in the HSE.
Brilliant. Thank you for that. You'd mentioned a little bit about benchmarking against standards internationally. Where do you think the patient safety culture is at in Ireland right now?
Well, I think we're in quite a good place, and that's why I'm kind of interested. The OECD, for example, are developing a tool to help actually measure culture. So I think that's something I'd be keen to do, to be able to show others and ourselves where we are at. We've come a long way. Many people on the call will know that often developments in patient safety come from, I suppose, having to respond to quite maybe traumatic or challenging or difficult situations. So we have a lot of things in place with our new Patient Safety Act. incident management, open disclosure, our patient care experience. I think we are in a good place in terms of involving and including patient voices, but also staff listening to each other so we can learn and continually improve. So I think we're in a good place. I'd like to be able to show through evidence and benchmarking where we are and where those room for improvement is. I think Tim's mentioned about co-production, that we're now moving from just involving patients in what we do to really co-designing for the future.
Yeah, and the upcoming conference, the NPSO conference, which is an annual conference, is coming up, and the title on that is Nurturing a Positive Culture of Patient Safety, Listening, Learning and Responding. You have a call out at the moment for abstracts for that, I understand.
We do. So we have poster competitions across a number of patient safety themes, and then also AMR, antimicrobial resistance. The AMRIC team and the national plan is a really important part of what we do in the office. So yeah, so that's the theme, and it's really, I suppose, about bringing everybody together who are invested in and contributing to patient safety to nurture that more positive culture and to be proactive, and that we can, I suppose, not only now include and involve patient voice and our own voices that we're listening to, but to go with the theme of World Patient Safety Day, how to now elevate that up to the next level, and what do we need to do to have both a culture and environment where we, who I suppose are supporting patients, how we listen, how we hear what they're saying, and how we learn from that, and then support patients to be able to speak up. So we have to say, it's okay to speak up, and this is how we will respond. And I think the work that you've done, and particularly with the resources with Patients for Patient Safety Ireland and with NALA, will be really important in giving people the confidence and the trust that they are included and that they will be heard. And that everybody has a part to play. Really, it's supposed patient safety is everybody's business, as we say, so that everybody has a contribution to continually listening, continually learning, continually responding to what our information and our dialogue shows us, so that we're always kind of improving. And then for me, that we're able to measure that and demonstrate, as I say, to ourselves and to the world where patient safety is headed in Ireland, and that we are on a positive track.
Fantastic, thank you. And it says we're honoured now that you're actually going to launch the resources for us. I'm not sure how you do a ceremonial, white ribbon on a webinar, but I'll hand over to you to maybe officially launch them for us if you could. Thanks.
Absolutely honoured. Yeah, I wasn't quite sure. Is it a kind of a ta-da? Hereby the resources are launched. But just to thank everybody who was involved, obviously, in developing them and who will be promoting them now. Particularly, as I've mentioned, Patients for Patient Safety, NALA, all of the teams in the HSE. And I think they're a fabulous resource in terms of, we talk a lot about patient engagement and patient empowerment. And in previous roles, I've always seen health literacy as the tool by which you empower people. It's a very important tool for people to have the agency, to have their voice. And the benefits for your health and well-being from improving your health literacy and feeling supported in your health literacy. So on our side, I'm particularly conscious when you work in somewhere like the Department of Health, how we communicate, that is kind of simple, it's clear, and the people, I suppose we're speaking to people in a way that is understandable and relevant to them. So I love the questions that you have, even for myself or anyone on the call. We're all patients as well. So I think everybody can do with a tip and a reminder when you are interacting as to how to use your voice, how to ask questions if you're not sure. And as I say, from policy land and working with HSE and everybody, how do we create then that environment where everybody feels that this is a shared care experience, and everybody's experience, everybody's voice, everybody's question matters in terms of us continually improving what we do, because I suppose care isn't care if it's not safe. And I think for Sláinte Care, we want care, all care. We're delivering more care than ever to people in Ireland. So it's a very active and growing health service, so that all care is safe and respectful care. So I think that's the goal for all of us.
That's fantastic.
So delighted to launch the resources, and I hope everybody finds them useful. And then I think you probably will have going through some more of the detail of each of the individual resources over the time of the podcast today.
We will indeed. We'll be able to touch on a few of them a little bit more later on in the session. But thank you so much for joining us this morning. I know that you're stepping out of a meeting to be able to join us, and we really appreciate that commitment. So thank you for that. And hopefully it's your first QPS Talk Time, but not your last. And we'll see you again. So thank you so much.
Thank you, and good luck to everybody, and enjoy celebrating the week and World Patient Safety Day. Thank you.
Many thanks. Thanks very much, Kate. And we're very lucky now. Kate talked about health literacy, and it has been an underpinning theme of this particular World Patient Safety Day planning, because there was that recognition, in particular from Patients for Patient Safety Ireland, that the whole theme around health literacy is central to patient safety. And if I can't understand, say, how to take my medication, or I'm not really sure what I'm meant to do when I go home after a surgery, or I don't know how to access information, then it makes patient safety quite a challenge for people. And that's everybody. I think we've all been in that scenario, sitting in a doctor's chair wondering or questioning what exactly it is I need to do next. So I'm going to hand over to Helen Ryan, and Helen is the health literacy lead with the Adult Literacy for Life programme office, and she started work in July in Solace, heading out on the health literacy as part of the government 10-year Adult Literacy for Life strategy. And she's going to share a little bit around some of the statistics around health literacy, and more importantly, a definition of what it is. So we'll pass over now to Helen. Thank you.
Thanks, Juanita. Hello, everybody. Great to be here. So the first slide, it's just, if people see, we're just trying to explain and set, I suppose, literacy, numeracy and digital literacy into context. So just, the next one there with the visual. And maybe people are aware of some of the statistics, but it's very important to perhaps go back and look at them, that 1 in 5, it's actually 1 in 6 adults struggle with reading, writing and understanding everyday text. You gave a good example there, Juanita, of reading stuff. I would say like reading a letter from a hospital. Again, if people think about it, or from your GP, that there are 18% of adults would struggle with that. We have a numeracy statistic. So again, these are from OECD reports that are done, and there's currently a new one in train, which is really interesting. But we know that actually numeracy is a bigger issue. So 1 in 4 adults struggle with, perhaps if you think of numeracy in everyday life, working out medication, trying to administer something to, be it yourself or indeed somebody in your life. And then finally, the digital piece as well, because we're all, I suppose everybody now is using things like mobile phones or engaging in some type, or we're being asked to engage with the digital side. And 47% of adults would lack those basic digital skills. So we know in Ireland that we have, many people who we need to consider when you think about them. The visual is very interesting there. The person's in the centre. Look at all those places that we use these skills every day. And obviously today we're here in particular talking about health and well-being. So just on the next slide then, just let's talk a little bit about health literacy, numeracy and digital literacy. So in the health context, what does this mean? So on the first side there is a European Health Literacy Survey result. So it's a recent enough survey that took place. The results are out, as in I can share them with you here, but the official report will be launched by the Department of Health hopefully in spring 2024. But we have had some information on this, and we know that 28% of Irish adults have limited health literacy. So what's that going to mean? Well, it's going to mean, again, that 3 out of 10 people that might engage with health services today would struggle with some of the things we mentioned earlier: reading a letter from a hospital, working out medication, or perhaps going online for an appointment, or to book a blood appointment, for example. Now, health literacy does have a couple of sides to it. The WHO, that the World Health Organization, looks at it from the personal side and the organizational side. So again, very interested in trying to progress some of them, particularly I'll talk about my role in a minute and what we will be looking into the future. But there is also community health literacy. This has come up really recently, talking to lots of the community health workers out there who are working with communities, maybe before we even need to use the health service. So again, behavioural change, I'm thinking of Healthy Ireland and the whole sort of initiatives around that. So there's a lot of work to be done, I think, around sharing some of the statistics and the issues with health services, but then working with people and with communities to try and ensure that, there are the things we can do to keep us healthy. And if we do present with some illness or some condition, how can we be supported in getting the best out of that? So the next piece then is looking sort of, well, what am I doing here, or what is this strategy we just spoke about? So the government, thankfully, did recognise that this is a major issue for our society, and they put together a 10-year plan and a 10-year strategy. And the minister is very clear, and he spoke again last week, actually, Minister Harris, around the fact that the failure of the literacy issue in Ireland is nothing to do with the individual. It is not a personal issue of them. It is a failure of the state and society that whatever the systems were in place at the time, they did not get that education that perhaps the rest of us here were lucky enough to get. So there is a 10-year strategy. It's very much a partnership approach, and we'll be looking at lots of these issues over the coming 10 years, but health was absolutely identified as a key point. So my last slide there, my last piece around sort of health literacy for life, and what certainly hopefully working, as I will be with the Department of Health, with the HSC and many of its sections, working with community health workers and working with the public and patients. We need to address this in a number of ways, and some of the ways there I've named around some of the policy ways, the practice ways, and working with the people. So so long as it's a 10-year plan, we will in this, and I'm really happy to chat to anybody. I know it's a very gave a real quick overview today, but I suppose to thank everyone for a lot of their work that they are already doing in this area. And absolutely, I'm sure anyone that works and has been engaging with adults around saying to them, will you read that leaflet, will you fill out that form, or here's your medication, that we know the impairment piece is that if they understand it fully, they're going to do it and hopefully then get better, and their treatment is on much more safe, and that we all have a role. And I look forward over the coming years to work with many of the people online here today, and indeed the patient safety angle as well on this. So thanks, Juanita.
Fantastic. Listen, Helen, thank you so much. I think the statistics are quite startling, really, when you look at it like that. And we are very lucky now. We have Norma DC, who's the National Screening Service Communications Manager for Information Development, and she's promoted the use of plain English and health literacy across the HSE for years. And she's also achieved plain English awards for various projects and uses it daily to help patients and clients access, understand, and use health information. She's going to share a few tips for anyone interested in making it part of your working life. So one of the biggest challenges is, how do you make this easier for people? And we're doing a lot of stuff, as Helen spoke about, we're doing a lot of stuff already, but being able to think about on a very practical level some of the things we can do. So I'll pass over now to you, Norma. Thank you.
Thank you very much for that and giving me the opportunity. I'm just going to share some very quick tips and guidelines on communicating in plain English with clients and service users. So let me first tell you a little story. A few years ago, I took my daughter, who had hurt her finger playing basketball, to our local injury unit. And after she'd had her x-ray and we were back with the doctor, he said to me, oh, she has an avulsion. And I went, an avulsion. Yes, an avulsion. Right, an avulsion. An avulsion. And he's looking at me and I'm looking at him, and I haven't a clue what he is saying to me or what has happened to her, but I obviously do not ask. Meanwhile, while he's bandaging her finger, I quickly open my mobile phone, and I remember back to my geography days where it comes up about a river splitting and going off in another direction. So that certainly wasn't helpful. So I left the surgery not having a clue what was wrong with my crying child, other than that she knew she couldn't play basketball again for a while. And I bumped into a nurse that I had known from previous work. And first of all, my crying daughter got a big hug, which you could say is a form of health literacy, because immediately then the crying stopped. And I said to her, listen, I said, she has an avulsion. What is an avulsion? So she explained in very simple terms that the bone was, after chipping off slightly, that there was a lot of nerves and tendons. And she was explaining to my daughter, not me, addressing her, and that they were like little spaghetti hoops that were still holding on her bone. So yes, the following day, I listened to my daughter explain confidently to her fellow 10-year-olds what was wrong with her finger. So it was kind of a little bit apart from what I had understood initially on the following day, thinking back to my river. So that kind of leads me into the next slide, which is the importance of understanding. So 20% of Irish people are not fully confident that they understand the information they receive from their healthcare professional. 43% of them, if they don't understand, would only sometimes ask for clarification. And 1/4 of us, so 25%, including me that day, was for embarrassment. I couldn't say to the doctor, I don't understand what's an avulsion. So some tips for speaking in plain English. Introduce yourself. Hello, my name is. It immediately puts the patient or client at ease and ready to engage with you. Make eye contact with them, speak to them. I know that can be difficult sometimes because we're looking down at our notes or at our medicines, but it's nice to say hello and look directly at the person. Speak clearly so that you know you're being heard. Put yourself
We've lost just a tiny little bit of your sound there, Norma. Maybe just while that's going through, maybe you could continue to talk to us a little bit about it, because I know you know this inside out.
So explain complex terms in plain English. Like if you use cardiology, you can also use heart, renal, you've kidney, pediatrics, you've children. So many of these complex terms could be put into plainer English rather than the medical words. Check for understanding. Invariably, if you say to somebody, well, did you understand everything I've told you? Yes, I did, of course. There's nothing you didn't understand? No, not at all. You understand everything? Yes, everything. That's going to be your answer the most of the time. So one of the methods for checking their understanding is called teach back. It's a common term and many of you will have heard of it before. So that's basically saying to them, look, for example, a physiotherapist, we've covered a lot today. Tell me what exercises you're going to do at home. How often are you going to repeat the exercise? And how often will you repeat it daily? And that will check for their understanding. You can go a little bit further with them by giving them maybe a little diagram which is showing a picture and explaining what the exercise is. And then very often you could go a little bit further, and that's just asking somebody if they really don't understand and you feel they're not getting it, you could actually make the ask them to take out their mobile phone. You don't have to show your face or anything, and just show them the exercise you are doing. And that little help will go a long way. And then when you're writing clearly, think about the reader and how familiar they are with the terms you're using, how you're going to share information logically. Think about when you're writing, being concise, being personal and direct, using everyday words and numbers, being careful with jargon and being concise. Writing in the active tense, so rather than you will be called, we will call you. This is just a very, very simple example of something that was very complex and how you could write the very same thing to have the same meaning. And again, it's a big example, but just to give you how things could change. So when you're designing them and your structure, use headings, use bold to highlight, short paragraphs, left align them, use bullets, and use charts and images to back it up. Avoid uppercase, because the way we learn words is by their form. And if we see all in black caps, it's more difficult to read. So our italics, long sentences, justified paragraphs might look lovely on a square page, but apparently the holes in it and the gaps that come when you justify make it more difficult to read. And also text on the top of images is very difficult. And I'll leave it to yourself. The one on the right follows the guidelines in plain English, and you can decide which one you find easier to read. So how does all this link to patient safety then? So research has found that people who don't fully understand their condition or treatment, they're more at risk of hospital admissions. They're more likely to make a mistake when taking their medicines. They're less likely to attend for screening. They're more likely to attend the emergency departments more frequently. And unfortunately, they are more likely to die younger. And that's it from me. So thank you very much. Most of those tips and guidelines came from the HSE's guidelines for communicating clearly. And I think somebody has put the link to that in the chat for you. So thank you.
That's fantastic. Thanks very much there, Norma. And it really is, when you talk about people dying younger because of being able to read or understand materials coming from healthcare professionals, it's quite stark when you think of it like that. So it does have a huge impact on safety and on our general health. At this point in time, I suppose it's really helpful, I think, to have the guidelines and the insight and know where you can go for more information. But we're going to go to some of the services now, where we're going to chat a little bit about what's happening for World Patient Safety Day. So we're going to start off with Paula Cusson-Murphy, who is the Director of Quality, Risk and Patient Safety in UL Hospital Group, and Beth Farron, who's the Patient Safety Manager working in QPS at ULHG. And Beth has a clinical background as a general nurse in emergency medicine. So pass over now, and Paul and Beth, could you tell us a little bit about what you're doing to celebrate World Patient Safety Day?
Yeah, thanks a million, Juanita, and good afternoon, everyone. I suppose this is probably our second year of really, I suppose we put a lot of effort into implementing our patient safety strategy, and we always plan it around our World Patient Safety Day. So it falls on a Sunday. So we've adopted the approach last year and this year that we actually put in place a full plan for the week. And what we try to do is make sure that we have every one of our sites across the hospital group that are involved. So I'm very lucky in that I've got Beth as my patient safety manager. So there's been planning for the last number of months as regards what are the events and what's going to be our approach to support the whole World Patient Safety Day. So I'm going to hand over to Beth, who's going to take you through what we've planned for the week for the group. So thanks, Beth.
Thanks, Paula. So what we're doing is we're kind of doing a two-pronged approach. So we're going to be looking at both the patients and the staff working in our services. So as you can see from the slide, we have a full programme of events for the week. So on Monday, we're going to be going out to Croom Hospital, myself, other members of the QPS team, our PALS management team, and also members of our patient council, which is really fantastic. And it's great to have them on board because they really play an active role here in the UL Hospital group. So we're going out to Croom Hospital and we're going to be doing the Safer to Ask campaign. So we're going to be meeting patients in clinics and we're going to be in the main foyer and we're going to be talking to patients and giving out the resources that the national QPS team have provided. And we're also going to be handing out the Safer to Ask leaflet also. And we're just going to be encouraging patients to make sure to ask questions before they go into their clinic appointments and to just be encouraged to be actively involved in their care. In the afternoon then, we're going to be taking the same approach on the UHL site, going into our busy fracture clinic and the OPD clinics. And again, we're going to have our patient council representatives with us. On Tuesday then, out to Ennis Hospital in the morning. And then in the afternoon, we're going to have an open disclosure workshop on the UHL site. And we're also going to be having a good catch session, which is a new patient safety initiative, which is basically what we're doing is we're trying to get our line management and other members across the hospital to put forward staff members who have recognised deteriorating patients or any kind of other episodes of good catches around patient safety. And we're going to be giving those staff members badges. On Wednesday then we have an all-day patient safety MDT learning event for frontline staff, and we have speakers from across the hospital that will be taking part in this, covering topics such as falls prevention, the delirium, and we also have our legal team who are going to be doing a talk for staff in relation to documentation and patient safety. And again, just looking at really positive patient safety initiatives that are going on across the group. On Thursday then, we're going to be going out to Nina Hospital again, engaging with staff and patients. And on Friday then, we're going to be going out to our maternity hospital and we're going to be promoting the fantastic work that they've done on their patient information and QR codes. And this is for our postnatal ladies, and just to make sure that they have all the information that they require, and again just to make sure that they're asking all the correct questions before they leave the maternity hospital. In the afternoon then we have a cardiac arrest simulation, again another amazing patient safety initiative that's been ongoing across the group, and that's been led by one of our consultant anaesthetists, Dr. Roisin Lee, and she's been doing some great work with that. And again, we're going to have rolling education sessions for staff in the afternoon. So we have a full programme of events, loads going on, and we're going to be using the hashtag World Patient Safety Day 2023. So make sure you check in with us on Twitter and see what's going on with the UL Hospital Group.
That's fantastic. Thanks very much for that, Beth. And there's a huge amount there. And Paula, you're also using It's Safer to Ask campaign. How do you think we can encourage people to ask us questions? Because that's one of the big things that comes up time and time again.
Yeah, thanks, Juanita. I suppose one of the things that I was glad to refer to earlier by one of the speakers is just a simple piece of introducing yourself and saying, hello, my name is, and I've got my name badge on. And that's one of the things that is really, really important, just that simple thing that people can see who you're actually talking to, because we wear scrubs and different things in different areas. So it's just those simple communication pieces. And I suppose other pieces that we try to do, we have a lot of different things, because I think there's no one fix for this. I think there's a multiplicity of things that we need to be doing. Like we have our medications list, so that we put that on the back of our outpatient letters when they're going out, so that people have an opportunity to come in and discuss their medications when they're coming in to outpatient appointments. We're rolling out communication training for staff, because we know that when you hear that people are having difficulties, that 28.4% of limited health literacy, we know that communication is critical to that. So we're rolling out our communication modules on that. And we have a really, I suppose, a strong PALS team, which are there supporting patients when they're coming in with people with disabilities and things like that who need that support when they're coming into outpatients, so they go to the clinic with them. And I think just Beth has referred to it, having a really active patient council, that we use the reps from the patient council to sit in our committees to keep us grounded.
Yeah,
And I think that's really important from our patient experience, because we're doing an initiative pilot around visual info cards, just because exactly that, the piece around, you may not be able to read it, but the visual piece. So we're doing a pilot on how we can promote that, how we can share information with patients and visitors when they're coming in as regards using visual rather than the words. So they're just some of the things, Juanita, I think that people can look at.
That's fantastic. And you're right, the dynamic changes even when a patient is in the room. With some of the meetings that we're holding, it does keep us grounded, and it gives us great pleasure. Thanks very much to Paula and Beth. But we're now going to go over to Clara Meehan, who's a health and social care lead with the transition team in the mental health services in Roscommon, and Cathal Kilcline, who's a service user representative with the transition team within the mental health services in Roscommon. And just to say, Clara, to somebody on the line today who was in school with you, you'll see it in the chat box if you're looking to connect in later on. But before we get into that, I'm going to pass over to Clara, and you might tell us a little bit about what you're doing to celebrate World Patient Safety Day in Roscommon. Thanks.
Thanks, Juanita, and good afternoon to everyone on the webinar this afternoon. So I'll just move on to, so what we are doing in Roscommon Mental Health Services, actually tomorrow, we're going to conduct an information event to mark World Patient Safety Day. So it's going to happen in the Primary Care Centre in Roscommon Town. And the reason we have chosen to do an information event is this is actually directly from the feedback from service users and family members, which have highlighted the need for more information on mental health services and supports that are available in the community and within the service itself. So the information event will include a number of stands with some of the following organisations and representatives. So we'll have a stand on our own service user family member engagement project that myself and Cathal have been doing for the last 18 months. We'll have a stand on the Safe Wards initiative, which is an intervention in mental health that Cathal is going to talk to you all about shortly. We'll have a stand also from Westby Well. So Westby Well is a service that provides information on voluntary, statutory and community groups involved in wellbeing, mental health promotion and suicide prevention initiatives across Galway, Mayo and Roscommon. We'll have the Mental Health Engagement Recovery Office with information on the local and regional forums that are available. And we will also have a stand from the Melting Pot Cafe. So just to explain what the Melting Pot is, it's a community cafe that provides social connection and support to people in the community. And it also has a range of activities on offer via its new involvement centre. And we will also have representation from Regari Recovery College. So Regari provides recovery-based education to people in the community. It's not just for service users and family members, but it's also there for the wider community to access as well. We will also have our family peer support worker with information on supports for families. And finally, we will have a stand from social prescribing, which really helps individuals to become more active and engaged within their community. So I'm going to hand you over now to Cathal, who's going to tell you a little bit more about the Safe Wards intervention.
What is Safe Wards? Safe Wards is an intervention to reduce, restraint and restrictive practices, which is internationally recognised. It has been introduced in Roscommon Acute Psychiatric Unit over the last 18 months. There has been a large reduction in the use of restraints since the implementation of Safe Wards. Safe Wards contains 10 interventions, and I will describe 3 of these. Mutual expectations. The aim is for staff and patients to have a shared understanding of what behaviour they expect from each other. Soft words. This initiative provides ways to avoid confrontation, work collaboratively, and enhance team communication. Positive words. This addresses communication of patient information and the use of positive expressions and offering psychological explanations of difficult behaviour and clinical handover. So they're just 3 of the 10 for Safe Wards.
Brilliant. Look, and thank you both for sharing that. Cathal, you've been a service user representative for quite some time. Could you tell us a little bit about why you became involved?
Well, when I was sick, there was no service user representative. It would have been nice to have somebody that had lived experience. And I felt that through all my years and all my experience of illness, I felt like that if I was in a position to help somebody that was when I was very sick, it would have been. I did get help from the patients when I was sick, but obviously a service user representative would have been a great addition to the team. When I was sick, I would really appreciate it. So I said that why not use my experience and maybe help somebody along their journey of recovery, and whatever information and knowledge I have, I can pass on to the next person and maybe help someone that way. So that's why I decided to go down that route, you know.
Fantastic. And tell me this, the safe wards, do you think it makes a big difference locally?
So far, it's been safe wards and made a huge difference. The staff are a lot more positive. The patients are a lot more positive in the acute unit. They're very conscious. They put up posters, and people have discharge cards where they leave a positive message when they're leaving they have a discharge tree where they leave positive messages on the tree when they're discharged, and then the new patients come in can read all the messages. So there's all these small things that they do in safe wards that make a huge difference. I've outlined 3 there, but there's 7 other implementations. And so far from the information we're getting back is there's been a huge reduction on the restraint in the ward, and there's a lot more positivity, and there's a lot better connection between the patients and the staff. So
brilliant. That's absolutely fantastic. I can imagine it makes a huge difference to the working environment as well, even from a staff perspective, you know, when you don't have the stress of it all. So that's really interesting. So thank you for sharing that. What I'm going to do is we're going to be moving over to Martina Porter, who's the Quality and Safety Manager. But just to say thanks firstly to Cathal and to Clara on that. And just to say, if you're interested in learning a little bit more about some of the work that they've done, we have an article in the Quality and Patient Safety Matters, the last edition, up online. You can Google it, Quality and Patient Safety Matters newsletter, and you'll find there's an article there that talks a little bit about some of the work that they've done to capture service user input and feedback for the design of services, which is really, really interesting. So thank you both for joining us. And we're moving over to Martina Porter now, and Martina is the Quality and Patient Safety Manager at Letterkenny University Hospital. Could you tell us a little bit about what you're doing to celebrate in Donegal?
Yes, well, good afternoon, everyone, and I'm just delighted to be here. So this Friday, to mark World Patient Safety Day, we are launching our patient safety bedside poster, and I suppose to give a bit of background of where this came from, we were looking at, you know, our most commonly reported incidents and our service user feedback, and, you know, it's how do we bring this learning and information back to the bedside and give patients information that empowers them, and, you know, in line with the patient safety strategy, you know, empowering patients to be active participants in their care, and equally to help improve patient safety and give patients tools to be involved in all of that and what we're trying to do. And equally, you know, giving people information that they can access through the QR code. So smoking cessation advice is there, hand hygiene advice is there, our patient information booklet for the hospital is in there, the No Check Ask medication safety campaign is in there. There's top tips, you know, on helping us plan your discharge and that collaboration, working together to plan your discharge. How to protect your property, and all of those things are included in it. And equally, and most importantly, we had launched a patient feedback questionnaire in January of this year, which was very successful. We have had almost 400 responses now, with some excellent both qualitative and quantitative feedback. So it also invites our service users to complete the questionnaire and how to do that. Also, it directs them to your service, your safe, for any comments or compliments that they would like to leave there. And there's a QR code that will bring them directly to the website to do that. And there's also an invitation. We're currently setting up our patient and family experience group. And there's an invitation there with an email address to invite people to join our experience group as well. So this brings all of this information to the bedside for people to, I suppose, empower them to engage with us in a really meaningful way.
That's fantastic. Thanks very much for sharing all of that. I'm conscious there's so much information. I know when I read this first, there's so much in it, and it is practical sort of advice and the sort of questions that you'd have when you come in as a patient. So it's really, really excellent piece of work. So thank you for sharing it with us today. And I know that you're involved in other pieces of work at the moment, and hopefully we'll be able to share some of that as time goes on in the future. So thank you very much, Martina. Just talking about the resources that are available, we're going to just pop up some of the the key resources now that were launched earlier on by Kate. And we're just going to just maybe pop up the website because it's probably the easiest way that you're going to be able to see it. So we have the website. So if you Google World Patient Safety Day 2023 and you look up HSE, you'll be able to see the resources that are up online. And the first thing that's on it is the animated clip, and we might just play the animated clip very quickly if we could. But it focuses on three key questions and an option of a fourth. And these questions, we tease these out. It started off with something from UL Hospital Group, and we worked on them then with Patients for Patient Safety Ireland, the HSE, and the department to refine them further for an Irish audience. So we'll play it there.
Your health, your voice. How can I play a more active role in my own care? When visiting your healthcare professional, it is important to ask questions. Asking questions will help you to understand your healthcare needs and will make your experience safer. Here are some good questions to ask. 1. What do I need to know now? 2. What do I need to do next? 3. What can I expect and how will this help me? Remember to ask, what do I need to know now? What do I need to do next? What can I expect and how will this help me? This video was developed by the HSE in collaboration with Patients for Patient Safety Ireland and the Department of Health for World Patient Safety Day. For more information, scan the QR code.
So you'll see there just on the webpage, the video clip is probably one of the first things to come up, but there's also a leaflet that's there, and you can see on the leaflet there's a written and a spoken version. We're very conscious, the whole team of health literacy, some people may not be able to read the leaflet, so you can see there is a leaflet, but there is also a clip that people can watch that has a spoken version of that leaflet that they can look at. And we won't play that one. You could be here a while with that one. But with it then, we also have a poster that's there. It's a green background poster with the HSE colours, and it has the 3 key questions on it. And there's a print run of those that have been sent out through the QPS leads. And the idea being that, and it's probably quite important, the 3 key questions, the what do I need to do now, what do I need to do next, and what can I expect, how will this help me? The how will this help me is really important because, as Helen was saying, it's very important that people understand the reason why we need to do things. It's a motivator for us, and if you understand why, you're much more inclined to follow guidance or instructions that you might get. In addition to that, then on the site you'll also see we have information there on the introduction to World Patient Safety Day videos. So we have a number of videos there that you can watch with Aisling O'Leary from Patients for Patient Safety Ireland and Joe Ryan, and there's 2 more that are going to be up there over the next few days with Bernie O'Reilly from Patients for Patient Safety Ireland and Dr. Colm Henry, the Chief Clinical Officer, and you'll be able to have a look at those over the next few days. We have patient partnership stories, elevating the patient voice then. So we have 3 key videos, and these are really worth a watch. They elevate the patient voice, but they also, through elevating the patient voice, highlight areas that will improve patient safety. And it just shows the power of storytelling. We have the QPS TalkTime webinar series, and what Chris has done is within the TalkTime webinar series, we have a number of episodes in the past on patient partnership. And there is a QR code poster there that you can scan, and you'll be able to look up some of those past episodes. And they're all there on a playlist, so you can look at the patient partnership ones together. And this episode will also be available there, that you'll be able to see that online at a later stage. And obviously, there's a lot of other things that impact patient partnership, including psychological safety. So some of our episodes from the previous season on psychological safety will also be useful. The next thing is the Walk and Talk Improvement podcast. We have a Walk and Talk Improvement podcast series, and we've just launched the episode 8 of it. It's called Bearing Witness Through Life and Death, and it is this was a podcast with 2 people, the Chief State Pathologist, Professor Linda Mulligan, and Mary Cregan, who's a patient partner with Patients for Patient Safety Ireland and who's chair of Féileacáin. And this particular one looks at the impact of patient partnership on the development of the HSE National Clinical Guidelines for Postmortem Examination Services. So if you're in end-of-life care, if you're interested in patient partnership in general, this is definitely worth a look at. And there's obviously many more podcasts that you can look at there, including the very first one, which was on engaging patients as well. So you can look back at the back catalogue and see there's another one there on empowering and enabling patients. And then the very final things in terms of it is we have the Quality and Patient Safety Matters newsletter, which will be launched at the end of October. And we're hoping that we will capture in that stories from across the country in the QPS community about what's happening around the country for World Patient Safety Day. So do let us know, because we'd love to include your stories there. The deadline is the end of September. And the very last thing then is there's some useful resources that you can tap into. And then there's a what can health and social care staff do? And there's some top tips there, things like the A to Z of medicines list, the My Medicines list, and some other useful resources, including how you can encourage people or where they can become patient partners. So if we've patients listening and they're interested in becoming patient partners, there's some guidance there on how they can get involved. So I'm going to pass over to Tibbs, just who's been looking at the chat box. And we have some time there to have a chat and take questions for the panel if anybody has anything coming through. So thanks, Tibbs.
Thanks. Thank you, Juanita. So a lot of really good input into the chat. Starting with Claire Noxon has a question for Helen Ryan. I think it was Helen. What is your opinion of a patient being CC'd in on copies of GP letters? For example, if a patient is seen by a specialist OPD and they're writing back to a GP, should the patient be CC'd on the letter?
Okay. Well, I suppose all I can give you is my own personal opinion. I mean, there would be healthcare people who would have opinions as to what's appropriate or not. I suppose from a patient, and I look at this from a perspective of health literacy and as a patient, I would want to know what is being said, but that should have been agreed in advance. So I recently was in hospital for a procedure actually, and I did get an email back and it was CC'd to my doctor and I got the exact same letter. Now I told some people this and they were like, really? Yes, but this is the way. I'm happy with that. It's there. So I don't really think it's a health literacy issue. I mean, yes, if I get a letter or an email back and I struggle with my reading, what do I do? Well, lots of people with literacy needs tend to have literacy supports in their life. So they would have someone to help them read that. Or indeed, perhaps that has been discussed in advance. Look, I'm not great at the reading of letters. Would you mind if you rang me with what's in the letter? And those could be agreed. But I mean, as I say, look, from a medical clinical perspective, I have no idea what happens on the ground or what should happen. But from my own personal position, if I was a patient, I would want to see what is being sent about my own healthcare and my treatment and so on.
Thanks very much, Helen. Claire, I hope that that answers the question. I hope that helps. There are some quite a few comments from after Norma's talk as well. Orla Kenny, great example. It's unfair when jargon is used by clinicians. People feel too embarrassed to double check or question. Liz Cotter has asked a question actually. Is anyone using SMOG as a tool, SMOG, as a tool to measure readability of their patient information leaflets or booklets they produce? Is that something any of the panelists have come across before?
Yeah, there are a few different ones, and you can use SMOG. Word has one. If you go into properties, you'll find one in there, and they check the kind of age at what somebody would have reached in education to be able to read something. Hemingway app is another one. So use anything that will make your writing more easy to understand. Helen probably knows a lot more about that too, but yeah, they're all out there and they're all available, and it would help. I see there's
great to have them,
Hemingway,
actually.
yeah, and it's just Hemingway. If you Google Hemingway, it'll come up straight away. There are a few of them listed in the Communicating Clearly guidelines.
Yeah, and Jane makes a point, thank you. And Jane makes a point as well. It's helpful when healthcare professionals don't rush when explaining things to patients. When they feel rushed, they feel that they can't delay the healthcare professional or don't want to bother them. So it's about the environment that's created. Any comment on that, Norma?
Yeah, and I mean, it can lengthen the appointment. Absolutely appreciate that when you have to explain something. But I suppose if you looked at it on the whole and down the line, if somebody understands leaving what they have to do in terms of medicine instructions or prescription instructions from a pharmacist, it'll stop them coming back maybe, or just make their appointment safer. in general.
Just on that, just to come in there was a very interesting study a few years ago, and what they did was they timed people. So a clinician would come in and would say, this is all the information I think you're going to need to know. And they would start at the beginning and they would tell them everything they thought they'd need to know, versus the clinician that came in and said, what would you like to know today? And what they found was the clinician that started with the what would you like to know and then supplemented with any gaps, those appointments, those consultation periods took less time than the one that went in and said, I'm going to tell them everything I think they need to know. So there's something about our perceptions of time on that. So sorry to come in there, but I just thought that was interesting or timely a comment around that.
Yes, there was a previous QPS TalkTime on narrative medicine as well that the recording is available for anyone who's interested in following through on that. Thank you. A lot of good feedback for Cathal as well. Thanks for your insight and contribution. Thank you for sharing your experience. Great feedback on Tina's work as well in Letterkenny University Hospital. And finally, from Valerie Toomey, thanks everyone. Really interesting information, example and stats. Brilliant to see the focus on health literacy. We're looking forward to rolling these out in CHO, Dublin North City and County starting this week. So that's great to hear. And hopefully there'll be others who are doing the same. One last thing that's just popped up, Orla Mahoney, I really liked Carl's reference to mutual expectations and connection, both so important for meaningful patient partnership, empowerment and supporting health literacy. Thanks, Carl. That's it. I think those are all the comments.
Fantastic. Thanks very much for that then, Tibbs. And we'll pop back up just the quick presentation for the final slide or two. And just to say, all the resources are available. They're there. People can use them, and please share them widely, because very often in an organisation as big as the HSE, we find that sometimes it can take a while for resources to trickle down, and they have been sent out through the system and through the line, but they're free, they're available, so send them anywhere that you'd like to. And equally, if somebody's from an organisation outside of the HSE, please feel free to use them if you think that they're helpful. They're all there and available. Just in terms of our final piece, we've been using the hashtag WPST23. So we'd ask you that if you're doing stuff during the week, use the hashtag WPSD23, so World Patient Safety Day 23, because we want to be able to track and keep an eye so that we can pull some of those really good examples and share them with the broader QPS community. So if you're doing something locally, we would love to be able to share it with others. And one of the ways that we can do that is by tracking the hashtag. We can look for it and search for it, and then we're able to share the resources for others. So thank you for that. Follow us. You can follow us. We mentioned this earlier on the social media. And just to say, our next QPS Talk Time then is coming up, and that's on the 26th of September, and it's on venous thromboembolism, using QI to reduce harm and promote recovery. And it promises to be a really interesting session on a very important quality improvement, quality and patient safety topic. And finally, just to say that in terms of today's session, thank you so much for joining us. There is a very short survey that we would love if people would take just 2 minutes to fill it in as you're leaving the talk time today. And what it does is it gives us feedback on whether or not this was useful for you, whether it was helpful, and also gives us an opportunity then to get some ideas on future QPS talk times. So thank you so much for joining us, and thank you to Tibbs as co-host, and to all of our panelists, and also then to the project team who are working on the resources, and in particular the members of Patients for Patient Safety Ireland. Thank you, and all have a lovely afternoon.
Thank you.